for a national plan. A stack of paper is not a plan. A large and unwieldy stack of paper is not a plan. A plan is a comprehensive and coordinated strategy for victory, and we haven't seen anything like a plan. No one has shown us anything. Blaming other countries is not a plan. Blaming China is not a plan. Blaming China is not even a good excuse for the lethal incompetence and disinformation of President Trump. China's early cover-up of the disease only deepens the responsibility and complicity of President Trump, who on 37 different occasions, as I've demonstrated by submissions to this committee, defended and excused and praised the Chinese government and President Xi. A plan is a plan, and we haven't heard what the plan is, and this is what has bedeviled us from the beginning. Mr. Chairman, we've got 4.4 million cases. We lead the world in case count. We lead the world in death count. More than 153,000 Americans are dead right now. 54 million people filed for unemployment benefits. We've seen a one-third drop in GDP, a one-third drop, unprecedented in economic activity. The chart behind me demonstrates the astonishing and terrifying growth of this disease. It took us 98 days to reach 1 million cases. It took us 44 days to reach 2 million cases. It took 26 days to reach 3 million cases, and it took us only 15 days to reach 4 million cases. Director Redfield, when do you estimate we're going to get to 5 million cases? What's next?
Thank you, Congressman. I think one thing I've learned about this virus is it's not predictable. I will say one thing that's important, that what happens next is really dependent upon if the American public fully embrace what we've asked. If they fully embrace those 5 steps, we'll get control of this pandemic.
Well, I thank you for that, and I thank both you and Dr. Fauci for restating the absolute imperative importance of everybody wearing their masks when they're out in public, and everybody maintaining social distance and following the other public health protocols. But the public health officials have been subjected to harassment, and we've even seen some today, have been subjected to ridicule and have been subjected to ludicrous, absurd contradiction. So I want to go through some of the propaganda and disinformation quickly, just as a public service announcement, because America is watching you. And Dr. Fauci, why don't I start with you? Are children almost immune to the disease? Just yes or no, because I've got a lot to get through, please. Are children almost immune to the disease?
You have to be a little bit more precise. You mean almost immune. Do children get infected? Yes, they do.
Have hundreds of thousands of children been infected?
Yes.
Hundreds of thousands of children been infected, so children are not almost immune to the disease. Is COVID-19 going to magically disappear, Dr. Fauci?
I do not believe it would disappear because it's such a highly transmissible virus. It is unlikely that it's going to disappear.
Does wearing a mask give people COVID-19?
Does wearing a mask give it? No.
Okay.
Not to my knowledge.
All right. Is COVID-19 a hoax?
No.
Should people take hydroxychloroquine as a cure for COVID-19?
The overwhelming cumulative evidence of properly conducted randomized controlled trials indicate no therapeutic efficacy for hydroxychloroquine.
Can people cure themselves of COVID-19 by injecting themselves with disinfectant
No.
or bleach? I'm sorry?
No.
Are you safe from the disease if you go to one of the aforementioned large assemblies, crowds, demonstrations, without a mask on and not observing social distancing, if you sign a waiver that you won't sue the sponsor of the event?
I'm not so sure those things are connected, but I'll repeat what I've said multiple times, that being in a crowd, particularly without a mask, is a risk for acquisition and transmission.
Okay, so, but signing a waiver doesn't confer any kind of immunity on you from being infected by the disease?
No, of course not.
All right. Dr. Fauci, the European governments are in a completely different place. They've got the disease on the run. In fact, The Asian countries have the disease on the run. I saw some remarkable figures. Almost every other country on earth is doing far, far better than the United States, except for Brazil, whose president has followed President Trump's policies. But we have 153,000 dead. Canada, our next door neighbor, has less than 9,000. We have 17 times the number of deaths from it. China, which of course is much larger than the United States, has lost 4,661 people. We've lost 153,000 people. Our rate of death is 36 times higher than China, and on and on. Do we have the financial resources and the scientific expertise in America to do what other governments have done to bring the infection rate down to something manageable so the end is in sight of this nightmare?
I believe we do have the tools, and certainly there's been a considerable degree of financial investment.
So what is the difference? Why are all of the other countries defeating the disease and we're not? Why do we not have a plan, a strategy for victory to win, to beat COVID-19?
Well, I believe I addressed that in not only my opening statement, but also in response to the question of the congressman. And that is that when you look at the comparison between Asia and Europe, as is shown by the chairman's poster up there, that when they shut down to the tune of about 95%, getting their baseline down to tens or hundreds of cases per day.
So
whereas when we did it, we got it down, but unfortunately, our baseline was 20,000 a day.
All right, so we're getting somewhere, but would you agree with me that the critical difference is either the presence or the absence of social cohesion and political leadership to actually develop a plan, execute it, and stick to it?
I think there was such a diversity of response in this country from different states that we really did not have a unified bringing everything down.
Yes.
The gentleman's time has expired, but Dr. Fauci, if you'd like to add more to his question.
No, I think I just answered the question.
I mean, the end of it was essentially, do we need to stop these disgraceful attacks on public health
The
officials?
gentleman's time has expired. I now
you. I yield back.
recognize Mr. Kim for 5 minutes.
Right, thank you. Thank you to the witnesses for